Before we begin, I want to say something clearly and calmly. A stroke is one of those events that people often think comes out of nowhere, but in many cases, the body sends signals ahead of time, not always dramatic signals, sometimes small, easy to ignore signals. And when you learn what to watch for, you can act earlier, and that can change outcomes. In this video, I'll walk you through 8 warning signs that can show up before a stroke. I'll also explain which situations increase your risk, what to do about those risk factors, and practical steps that can help lower your risk over time. And just so you know what this channel is about, we speak in plain language here. No panic, no scary storytelling, just clear guidance so you can make smart decisions for your future. Now, if you find this helpful, subscribe and turn on notifications. I post practical health guidance for adults 50 and over, with a focus on prevention and everyday habits that actually matter. And to help the video reach the right people, type 1 in the comments if you're watching, because you want to protect your brain and your independence. If this topic doesn't feel relevant, type 0. Your comment genuinely helps. Now let's get into it. First, a quick foundation, because it helps everything make more sense. A stroke usually happens in one of 2 ways. The first is an ischemic stroke. That's the most common type. It happens when blood flow is blocked, often by a clot or a narrowed vessel. The result is that an area of the brain doesn't receive enough blood flow and oxygen for a period of time. The second is a hemorrhagic stroke. That happens when a blood vessel in the brain leaks or bursts and bleeding disrupts normal circulation. You don't need to memorize those names. The reason I mention them is that some warning signs can appear before either one, and many prevention steps reduce risk for both. Now, here are the 8 warning signs to take seriously. Warning sign number 1 is significantly elevated blood pressure. This is the most important one, and it's also the one many people dismiss the most. High blood pressure can rise quietly. You can feel fine and still have blood pressure high enough to strain your blood vessels day after day. Over time, that strain weakens the inner lining of vessels and makes them more vulnerable. If the situation involves a risk of bleeding, high pressure can be the trigger that pushes things in the wrong direction. If the issue is blockage, high pressure can damage the vessel walls and speed up the buildup of plaque over time. And I want to address a common myth I hear again and again. Some people say, "This number is normal for me because when it's lower, I feel symptoms." Here's the problem. Feeling fine does not mean your blood vessels are fine, and feeling symptoms when the number is lower does not automatically mean the lower number is unsafe. Your body gets used to certain levels. If you've lived with elevated pressure for a long time, a healthier number can feel unfamiliar at first. So the key message is simple. High blood pressure is not harmless just because you don't feel it. And later in the video, I'll share practical ways to manage blood pressure in a safe, realistic way. Warning sign number 2 is a headache that feels different from your usual headache. Not every headache is serious, but an unusual headache deserves respect, especially when it's sudden, intense, or noticeably different from your typical pattern. Some people describe it as a headache that comes on quickly. Others describe it as pressure that keeps increasing. And some people notice headache along with changes in vision, balance, or confusion. If you get a new headache that feels not like me, don't ignore it. Getting checked promptly is a smart move. Now, I also want to explain something called a TIA, because it's related to warning signs. Some people call it a mini stroke. That phrase isn't perfect, but it helps people understand the idea. A TIA is a temporary interruption in blood flow to part of the brain. Symptoms can appear and then improve, often within minutes, sometimes within hours. The important point is that even if symptoms improve, it's still a major warning sign. It can be the body's early alarm system, telling you that you're at risk. If symptoms appear and then go away, that is not a reason to relax. That is a reason to be evaluated quickly. Warning sign number 3 is numbness or weakness on one side of the body. This is one of the classic warning signs, but people still ignore it more often than you might think. You might feel numbness, tingling, heaviness, or reduced strength. It might affect an arm. It might affect a leg. It might affect part of the face. It doesn't have to be the entire side of the body all at once. The reason it often appears on one side is because different areas of the brain control different areas of the body, and many brain pathways cross over. A problem in one area of the brain can show up on the opposite side of the body. Here's what matters most. Even if the numbness improves, even if the weakness fades, it still needs urgent evaluation. Don't wait weeks. Don't book an appointment for next month. This is the kind of symptom that should be taken seriously right away. Warning sign number 4 is difficulty speaking or understanding speech. This one can be subtle. Sometimes a person is talking, but the words aren't coming out clearly. Sometimes they can't find the right words. Sometimes they speak in a way that doesn't make sense. And sometimes the person can speak, but they don't seem to understand what you're saying. If you're talking to someone and you suddenly notice they can't follow the conversation or their responses don't match what you asked, pay attention. It can look like confusion. It can look like they're not themselves. It can be misinterpreted as stress or fatigue. But if it appears suddenly, treat it as urgent. Warning sign number 5 is a sudden balance problem or a change in walking. This is another one that people misread. A person might look unsteady. They might sway. Their steps might be off. They might walk as if they're dizzy. Some people describe it as they look like they've had alcohol, even when they haven't. Balance and coordination are controlled by specific brain regions. If blood flow is disrupted, even briefly, balance can change. If someone suddenly becomes unsteady without a clear explanation, that's not something to brush off. Warning sign number 6 is unusual fatigue that is more intense than normal. Fatigue has many causes, and I'm not saying every tired day is serious. But many people who later experienced a stroke reported that in the days or weeks leading up to it, they felt unusually tired. Not, I stayed up late, tired. More like something feels off, tired. A sense of being unwell, a change in energy that doesn't match what they did that day. When your body is under strain, it sometimes shows up as a general drop in capacity before more obvious symptoms appear. So if fatigue is sudden, unusual, and paired with other warning signs, treat it as important. Warning sign number 7 is a change in coordination or fine motor control. This can be easy to miss. You might struggle with small tasks, using a computer mouse, buttoning a shirt, holding utensils steadily, writing, washing dishes. Simple hand movements that usually feel automatic may feel awkward or clumsy. And I want to clarify something here. When people think stroke, they often imagine total paralysis. But many warning signs are smaller, subtle changes, a slight difference between one side and the other, a new difficulty that wasn't there last week. So don't ignore small changes just because they're not dramatic. Warning sign number 8 is sudden visual changes, blurred vision, double vision, loss of vision in one eye, or a sudden change in how clearly you can see. Vision changes can have many causes, including blood sugar changes, eye issues, and medication effects. But when vision changes appear suddenly, it's a red flag. An early evaluation matters because some causes can lead to lasting problems if you delay. Now that's the 8 warning signs. And at this point, you might be thinking, all right, but what can I do to reduce my risk? Let's talk about prevention in a practical way, and I'm going to give you 9 steps, just like the original structure, but explained in a calm, realistic way that you can actually follow. Prevention step number 1 is reducing excess salt and sodium. This is one of the highest impact, most overlooked changes. Many people don't realize how much salt they're consuming because most of it comes from packaged foods, restaurant meals, sauces, and processed snacks. Not from the salt shaker. Excess sodium can increase fluid retention and blood volume, which can raise blood pressure over time. Your body can handle a salty day once in a while. The problem is when high sodium becomes your everyday pattern. A practical approach is to check labels. Many labels list sodium in milligrams. As a simple guide, aiming for around 2,000 milligrams of sodium per day is a helpful target for many people. And if your doctor has told you to limit sodium more strictly, follow that guidance. You don't have to eat bland food. You just have to stop letting hidden sodium do the damage quietly. Prevention step number 2 is controlling blood sugar. High blood sugar over time can damage blood vessels and accelerate the process of plaque buildup in arteries. That increases risk for circulation problems throughout the body, including the brain. Even if you're not diagnosed with diabetes, it's wise to pay attention to blood sugar patterns if you have risk factors. This means discussing testing with your healthcare professional, being mindful of added sugars, and building meals around protein, fiber, and whole foods more often than not. And yes, this matters for brain health. Prevention step number 3 is not smoking. This one is straightforward. Smoking damages blood vessels and raises risk for circulation problems. Cigarettes, e-cigarettes, cigars, and any form of tobacco exposure can contribute. If you've been trying to quit, keep trying. And if you need support, talk to a professional because a structured plan often works better than willpower alone. Prevention. Step number 4 is managing cholesterol and other blood fats. There's a lot of confusing information online about cholesterol. So here's the simple truth. Your body needs cholesterol. It's part of normal biology. But excess levels of certain types, especially LDL, can increase plaque buildup in arteries, especially when other risk factors are present, like high blood pressure, diabetes, inactivity, and smoking. Cholesterol targets are not one size fits all. Someone with very low risk may have different targets than someone with higher risk. That's why it's important to interpret your numbers with a healthcare professional, based on your overall profile, not just one lab value. Also remember there are other blood fats, like triglycerides, that matter too. This is why a full lipid panel and a risk-based conversation is important. Prevention step number 5 is regular physical activity. You don't need extreme workouts. You need consistency. A commonly recommended goal is around 150 minutes per week of moderate activity. That can be walking, swimming, cycling, dancing, or anything that gets your heart working a bit more while still allowing you to speak in short sentences. The most important part is choosing something you can actually keep doing. Prevention. Step number 6 is weight management, especially reducing excess body fat. This is not about appearance. It's about how the body functions. Excess fat tissue can increase inflammation signals in the body and worsen metabolic health. Even modest weight reduction can improve blood pressure, blood sugar, and lipid patterns for many people. If weight loss feels overwhelming, start with a simple focus. Portion awareness, more protein and fiber, fewer ultra-processed snacks, and regular movement. Small changes that you keep are more powerful than aggressive plans you abandon. Prevention. Step number 7 is improving sleep and addressing sleep apnea. This one is more important than many people realize. Sleep apnea is a condition where breathing is disrupted during sleep. It can reduce oxygen levels and place stress on the cardiovascular system. It's associated with higher blood pressure and worse metabolic control in many people. If you snore loudly, wake up gasping, feel unrefreshed despite a full night in bed, or feel sleepy during the day, it's worth discussing sleep evaluation with a professional. Sometimes improving sleep quality improves blood pressure and blood sugar more than people expect. Prevention step number 8 is monitoring blood pressure correctly. Here's a practical tip. Many people have higher readings in a medical setting because of stress. Others have normal readings in the office but higher readings at home. That's why home monitoring can be helpful. If you measure at home, record the numbers and the time of day, and bring the log to your doctor. It helps them see patterns, not just one moment. And as a general rule, many guidelines consider around 120 over 80 as a healthy target, while repeated readings around 140 over 90 are typically considered elevated. Some guidance flags 130s as elevated as well. The important point is consistent patterns, not one isolated reading. Prevention step number 9 is checking for heart rhythm issues like atrial fibrillation. Many people don't realize that certain rhythm problems can increase clot risk. Clots can travel and block blood flow in the brain. That's why rhythm evaluation matters, especially if you feel palpitations, irregular heartbeat sensations, or episodes of a racing heart. A simple ECG can detect many rhythm issues. Sometimes a longer monitor is needed because rhythm problems can come and go. If you feel palpitations regularly, don't ignore them. Get evaluated. Now, I want to close with a calm reminder. The purpose of this video is not to make you anxious. It's to help you notice early warning signs and to take prevention seriously in a practical way. If you noticed one warning sign today, just take note of it. If you notice several, or if something is sudden, new, or worsening, it's wise to seek urgent medical evaluation. And please share this video with someone you care about, because the person who needs this information might not be the one searching for it. Now let me ask you, which of these warning signs surprised you the most? The unusual headache? The one-sided numbness? The speech changes? The balance issues? Or the sudden visual change? Write it in the comments. Your response helps others feel less alone, and it helps the algorithm share this with more people. If this was helpful, hit like, subscribe, and turn on the bell. And I'll see you in the next video, where we keep things simple, calm, and focused on protecting your health and independence for the years ahead.